Hello, welcome back. This second of three video lectures, we're going to talk more about secondary data sources, including registries, indices, and more. Stay with us and let's get started. Okay, facility-specific indices help hospitals track diagnoses, procedures, and physician activity. These indices are essential for locating records and analyzing care patterns. So some registries that you should be familiar with in your career in health information management include some of these listed here. These include the cancer registries, which track new cases, treatment outcomes, and this supports research and quality. This is where length of survival after diagnosis comes in and many other useful things that we use to improve the healthcare of cancer patients. We also have trauma registries, and this collects data on severe injuries. This improves care for these patients, contributes data for national safety efforts, and more. We also have birth defects registries, and these monitor newborns with birth defects. This supports prevention and care. We have diabetes registries that help manage diabetes. This continues to be a huge problem. And again, when you think about all the things involved in diabetes, a good thing to keep our pulse on. And then finally, we have transplant registries at major academic medical centers, Stanford, OHSU, UC San Francisco, and others. We keep a registry of everybody who's had a heart transplant or heart-lung transplant. And then finally, something you should be familiar with, we have an example posted later in the course, is the immunization registries. And this ensures that we have data on all children and adults who get required vaccines. And then we have other ones besides that. We have inflammatory bowel disease, implant registries for people who have joint replacement surgery, and all of those types of things. And each registry normally has a definition for how people get into this, right? So for instance, cancer registry, there's certain reportable cancer types that get entered into the cancer registry. And this is similar throughout other registries. More about cancer registry. These are patients, of course, with cancer. We again have certain definitions, and I'll be glad to share that with you later in the course. We collect data on them, and we have specific instructions on how to abstract these cancer cases, right? Where we're reporting certain data fields. We do some reporting and follow-up. And then the standards and the methods are approved by the American College of Surgeons. We also have a special certification. We used to call these individuals certified tumor registrars. Now that term is obsolete and they're called oncology data specialist or ODSs. And probably I think maybe 40% of the ODSs have an RHIT credential. So it's not one or other. The really successful people are pursuing both. More about trauma registry. Again, we have certain types of injuries that go into trauma registry. I worked on the Stanford University Medical Center trauma registry for a while, and we have certain case definitions and case findings. So this could involve ER triage notes, this could ER logs, where we look to see if there's anybody who meets the criteria for being included in the trauma registry. We abstract or collect the data, and we look at such things as the abbreviated injury scale. We look at reporting and follow-up. And there's actually a certification you can get to be a certified specialist in trauma registry. Another project that is usually state specific is the birth defects registry. And in California, this is a very large registry, and it's newborns with certain birth defects, right? And we, like any other registry, we have a certain way of defining these cases and what cases will go in the registry. We also have ways of doing case finding at specialty hospitals and so on. Kaiser Permanente and other large healthcare organizations are very interested in tracking patients with diabetes. Diabetes continues to be a big concern for the US Public Health Services. And we are looking at tracking patients who have a diagnosis of diabetes. We have certain things that define them, and then we collect data on them and run reports to look for ways to improve these patients' lives with diabetes. One thing that'll be interesting with the advent of these GLP-1 medications is what effect that will have on diabetic patients and their care. And the diabetes registry will be critical to this effort. And again, organ transplants registries, we normally see these at academic medical centers, your OHSUs, your University of Washington, UCLA, UC San Francisco, Cornell, Stanford. And again, these track people who are on the transplant list, and it also tracks their activity for patients who have had transplants. And we collect data on them. There's certain data points. Of course, now with the HRs, a lot of this can be captured electronically. But it's interesting to see that the life expectancy for heart transplant patients used to be on average, meaning the geometric mean, the average, if you will, that these patients lived an average of 5 years. Now, of course, they live well beyond that, mostly because of the advent of new medications. And here in Oregon, we have an immunization registry, and this tracks immunizations from multiple providers. And this helps with reminding people about the importance of getting immunized and does reporting and follow-up. It'll be interesting to see what happens with our government's current stance, ambiguous stance on immunizations. What will be the outcome of these registries? And again, we have many, many others. When I worked at Children's Hospital Oakland, we did a lot of efforts with cystic fibrosis patients, their acute coronary syndromes registries, and many others. For as many diseases that are out there, we can certainly come up with a registry. And again, these are created by and overseen in part by the National Provider Identifier Registry. Last slide for this one is the healthcare databases, and these are nationwide and state administrative databases. We have the MedPAR, which is the Medicare Provider Analysis and Review. We look at claims data, we look at demographic data, ICD-10, CM, and PCS diagnosis and procedure codes. And basically, it's a way of relating data points and improving patient care. And that's all I have for you. Come back for our third and final video lecture on this chapter. We'll talk more about the national and other healthcare database efforts. We'll see you then.